Dear viewers, all of us have a skin that we wear, right? What is skin all about? Not just that, how do we maintain the skin? Most of us also associate skin with beauty. But to understand the skin, I think you need to become a dermatologist. But I have with me today a professor of dermatology, Dr. Sharath. Warm welcome to the show, Doctor.
Thank you.
It's been of great interest to speak and understand skin. What is so much complicated about skin that, you know, people really try to beautify their own skin or maintain the skin or be worried about the skin, and because of worries also spoil their skin and all that?
No, skin, as you analyze, is not complicated. People make it complicated by various therapies and all. Skin is a very simple organ meant to protect all the internal organs. That is the main function of skin.
Most often because people see skin first on a person.
Yes.
Do you think that's why the importance to skin is given to such a
Precisely
great
because
extent?
of that. It's a easily
And because it's also worn on the face.
Exactly.
And when you see the person's face, you see the skin first.
Exactly. Skin acts as a mirror.
Okay. And when people say that, you know, face is the index of mind, first actually you look at the color of the skin. And you also treat a person according to the quality of the skin on his face, to the color of his skin, to the complexion, to the glow, to the dullness, to everything.
Not really.
You would like to differ, but that's the truth, isn't it? You know, the way people also have behaved through the history of mankind, based on the color of the skin also.
That's still in practice. Based on the color. A white skin person would command more respect than the dark skin. That is there.
Where the white supremacist people told always that, you know, people with darker skins were mud people. And if your blood showed on your face, that you're supposed to be of a superior race.
That's the reason, you know. That's the reason all this in the market you can see this fairness.
Everybody wants to become
Everybody wants to become fair.
Okay. But how can we understand skin? I mean, is skin as simple as you would like to describe
Definitely. I would definitely tell skin is a very simple structure.
Okay.
All you have to do is just pamper the skin little. Very little. Don't do too many things.
Okay.
No need to do too many things. Very simple. All you have to basically the relaxation. What I found is relaxation, stress. Stress easily shows on the skin. You can directly, by looking at the patient or a person, you can tell he is a stressed individual.
Is it because you try to contort the skin while you are in a state of stress? You put pressure on the skin, or is it a psychosomatic?
It's a combination of everything. Combination. It's a
because
change.
you know, if you're glum, you tend to pull all your you know, muscles together, and you know, you try to twitch and contort your face.
And also, see, there's a chemical called adrenaline in the body. During stress, no, you need the help of adrenaline. Adrenaline
that results in wear and tear.
Yeah, it also, you know, reduces blood supply to the skin. It constricts. So that's also partly. So all these things, as you said, you know, try to, you know, hold the skin tightly.
Because they say it takes fewer muscles to smile, and it takes more muscles to actually frown. But you more often frown than do the simple thing like smiling.
Correct.
Okay. But why is this sudden, or rather the recent interest in skincare?
It was there before, but it was not highlighted properly. You know, nowadays, partly because a lot of young crowd, a lot of people in the young age, they've started earning financially, they become independent, and you know, the general tendency now, people they want to look good also.
Is it also because of the awareness that you can actually treat the skin?
Awareness. Previously, people didn't know there's a dermatologist, a separate doctor for skin diseases, and general practitioner would have.
So only if you had some problem with the skin, you went to a doctor.
Exactly.
Not to actually maintain
a family
or
physician.
To take care of the health of the skin.
A family physician used to treat most of the conditions. So only when it never used to subside, then they used to come to skin. Otherwise,
what exactly do you define as skincare?
Skincare is basically, you know, I would tell in 3 words. One is basic hygiene, most essential things. A basic hygiene, a balanced diet, most essential, and relaxation. So these 3 things.
It is not about applying lotions and ointments.
Not at all. That's just a show. That's not really, you know, unless it's indicated some disease. Otherwise, generally, is the diet, is the
Why is hygiene important?
Hygiene is very important because see,
to prevent bacteria,
bacterial, fungal, all the infectious thing, and you know, you'll have to remove all the secretions are there in the body, especially body folds. You know, That's basically is very important.
It used to be a practice in olden days for people to scrub their skin, which is not something that you see so often these days. People would rather put some soap or some lathering cream and come out of the bathroom after showering themselves.
Correct.
But scrubbing was such an important process before.
No, we are totally against scrubbing. It is a psychological satisfaction.
Okay.
Basically,
but many people say that, you know, by scrubbing you exfoliate the skin.
No need to. The skin, see, otherwise also, skin has a natural turnover. Probably once in 42 days, it naturally turns over.
But is it important for you to remove the dead skin?
No. Just a simple hand or a soft loofah.
You don't have to actually
scrub
it,
No,
is
we
it?
Totally, in fact, all the patients, all the persons, we tell them not to scrub the body.
Why?
With that premixture.
Does it mean
one
that
is
you're exposing?
One is skin becomes very rough. And it can easily, enhance the aging, because it's like a rubber band. You just take a rubber band
and also it's exposed to all kinds of
infection. And skin becomes very dry. And pigmentation problem is very common in India because of rubbing. So and it's a psychological satisfaction. A simple.
But at least people say that, you know, after a warm water or rather hot water bath, you're supposed to at least clean your body with a little coarse towel, so that at least
that's okay, soft towel and all. But definitely not scrubbing it. See, now most of the people clean their face only with the hand, and still they keep it very clean.
Particularly to avoid scabies or even what do you call abscesses in the folds. Like pilonidal abscess, you're supposed to scrub your skin, and that's what even the doctors say, because they could be.
See, it's basically, it's a misconception. It has come from from your ancestor or something. Those days.
So you suggest that there is no need to scrub the skin at all.
It's basic daily. If you're taking daily bath and basic, that's enough.
And this fad about vitamin A, and everybody wants to consume as much vitamin A as possible. And you know that recently about this Roaccutane, right? Basically because it's a vitamin A drug?
It's a high concentrated vitamin A. But see, all these drugs, see, any drug would have its own side effects. One should know how to use it properly. I have no doubt Roaccutane, given a chance, is a wonderful drug. Provided you should use it judiciously. And day to day, what food you eat, lots of green and yellow vegetables, they do contain vitamin A.
But what kind of a role does vitamin A play in?
See, vitamin A is basically it normalizes the tissue generation, a cell. It's skin, what you call is keratin. It basically normalizes keratinization process. Basically. So in the deficiency of vitamin, you will have a lot of disorder of keratinization. We call it. A lot of things like vitamin A deficiency, you get phrenoderma, toad skin, dry skin. All these things could be because of vitamin A deficiency. There are a lot of diseases. Basically, vitamin A should not be excess also. So anything excess also poison.
So that would result in a lot of other things actually.
Definitely.
But most importantly, when people are not born with good skin, like when people have coarse skin or scaly skin or rough skin, I mean, is there actually a solution to it?
Yeah, definitely. See, now there are various conditions. One called ichthyosis. Literally, it is fish
scaling,
skin. Fish skin. Definitely, it is genetic. You inherit from parents. Especially, there's a consanguinity.
Such a psychologically painful thing, right? For women particularly.
See, unfortunately, science has not advanced so much to understand this basic defect in that. Definitely, we can improve the quality of life of these patients. You can improve, definitely. We may not be able to cure these conditions. Most of the genetic disorders, for that matter, all are controllable diseases. You take diabetes, hypertension, all these are controllable conditions. So definitely we can improve the quality of life of these patients.
Now people are quite interested in removing pigments, or rather moles.
Big business, correct.
But sometimes people don't even understand that they're prone to scarring also. And they try to apply as many creams as possible.
This is where a dermatologist really would help them. A dermatologist
just educating them about the kind of skin that they have to begin with.
You will have to interact with the patients. You take a proper history. Selection of case is very important. Any patient comes with pigmentation, you cannot just take those patients for any procedure.
And everybody cannot have hope also.
Exactly. Unrealistic expectation is very bad. You have to,
because even with the best treatment, even like using lasers also,
definitely.
There is only to an extent to which you can go about curing.
That's what I want to tell. You just cannot have a magic remedy skin. Everything has its own limitations. But if you select the patient properly, definitely these procedures, they do wonders.
But about removing extra hair on your face or in the regions that you don't desire hair to grow is also another thing that people are very interested in. Do people come to you about that?
Definitely.
One is about removing hair, and is about planting hair.
See, hair is such a structure.
Yeah.
Too much is also bad. Too less is also bad.
Okay.
The people who have less hair, they want the hair to be grown,
Okay.
scalp. Now, unwanted facial hair, they want it to remove.
Okay.
And you can see a lot of laser
Okay.
centers.
But is there any improvement in that direction?
Definitely. You can definitely improve the quality of life of these patients.
But there are two kinds of people.
Yeah.
One who use drugs to enhance hair growth, and
Exactly.
the others who do surgical implants or
transplantation.
and
Yes.
all that. But what is actually safer according to
See,
you?
this medical line of treatment are always temporary.
Okay.
As long as you use the medicine you want to take
Just
medicine.
using mint or
Exactly. All temporary. As long as you use
topical medicine.
Yeah, you do get hair growth, but then after stopping over a period of time it falls.
But does it mean that even if hair grows once in a certain area, that the area actually has the potential to grow hair, that maybe in the future at least you may be able to develop some drug to...
Yes, there are research going on now.
Okay.
They are able to think. But now hair transplantation is a very good procedure.
Okay.
Your own hair they are transplanting. It's not.
But won't it result in scarring, at least in the place where...
The selection of patient very important. If the patient has a keloidal tendency, say.
Okay,
if
because then that will result in something
yes,
else.
definitely. That's what I told you. You have to take the history properly.
And also, it should be a good surgeon
Good
to
surgeon.
actually
Yes,
sew it properly after it.
Correct.
But what about this, removing it strand by strand and planting it?
That's what they're doing now. That's what they're doing.
Instead of actually, before it is to be taking off
Take a full about 10, 15 hairs they have to plant it. It's like a paddy field.
Yes.
A paddy field effect it's called.
Yes.
From distance it looks lush green.
Yeah.
When you go there you can see the gap. Nowadays that has become obsolete now.
Okay.
Now it is the individual hair transplantation.
Okay, but once again, even in the US too, when they do that, you'll have to give a lot of drugs to resist any kind of, or rather take care of the body's natural resistance to...
For the hair transplantation, you need not give, because your own hair they're transplanting.
Okay.
See, unlike kidney,
Okay.
the match and after transplantation they give immunosuppressive drugs so that your kidney should not be
Okay.
rejected. Here that problem does not arise.
Okay.
Your own hair they're transplanting, your own hair.
Okay.
So absolutely no need of those drugs.
Is it actually possible for clinicians like you to educate people about being comfortable with your own skin?
Definitely.
Because most often,
No,
everybody wants a different kind of skin that they always aspire to have.
Exactly.
Which
No
that
doubt
they
in
should be very practical about having at least the knowledge that they can never have.
No, we do that.
Yeah.
We try to educate them, we try to tell the patient,
To learn to live with it.
Exactly. But
Yeah.
there are certain compulsions,
Yeah,
certain
because
requirements.
everybody tries some
Exactly.
lotion which can make them fairer.
Yes,
because
yes.
without
At
even knowing that
at
fairness is so entirely different from becoming white.
Correct. There are some patients, they do come, they want the baldness to be postponed, if not
Okay.
cured.
Okay.
Okay, doctor, I want to get married. Till then, I want to have a good hair. After marriage, it's okay. So there are certain, each patient is different for us.
Okay.
Depending upon his requirement, we tailor the treatment.
But there are hundreds of skin diseases
I know.
commonly
More
seen,
than
like
2,000.
white patches to
2,000 diseases.
fungal infections to all kinds. But what are things that people can actually get cured without much effort, doctor?
See, wherever you know the cause, if it's a bacteria, if you know it's caused by bacteria, you can cure them. If it's fungus, you can cure them. Where you don't know the cause, then the problem comes. You cannot cure them.
Sometimes people walk around with a white patch saying it's because of luck.
Probably.
Correct, because when they cannot find a treatment for it,
That's a
the
solace
easiest
thing.
thing to
I
actually
know,
say
no,
is that it's because of,
luck. Some people mole they consider as luck.
Yeah.
Some people want that mole to be removed.
Sometimes the mole can actually be just the outer symptom or the indication of something that's deeper.
Exactly. If any mole suddenly grows in size and starts bleeding and all,
Yeah.
it could be a malignancy.
Okay.
Any mole, if the patient says, doctor, suddenly it is growing and it starts bleeding, painful.
How much can the skin indicate the other conditions of the body?
Lot.
For instance,
And for an astute dermatologist, lot of disease can be, diagnosed by looking at the skin. We, in fact, tell skin acts as a mirror of internal disease.
Okay.
Lot of disease you can just by looking at the patient. Okay, he's diabetic. He is having this thing. Say,
also the condition of the liver can be seen on the
yes,
skin.
just to see yellowish discoloration
yes.
on the sclera, say could be a liver disorder.
Okay. And
That's
also if somebody is a drunkard also, you can see by...
Flushing,
yeah.
yes, definitely.
Okay.
Lot of things, lot of things. Skin conveys lot of meaning. There are certain signs we look for in skin
Okay.
diseases.
Okay.
Each sign is very, pathognomonic of each diseases.
Okay.
a lot of things. So, and in fact, most of the times, early diagnosis is made in the skin department.
Okay, you've been working in this field for such a long time, and it's because of your passion to work in this.
Yeah,
Basically, you love teaching, right?
Definitely,
and also to learn in the process.
Definitely.
Because that keeps enhancing your own knowledge.
It's a never-ending process. Every day.
Particularly, this field has been ever growing, right?
Very, very.
And every day you get
in
to
fact,
hear
today
about
dermatology is the fastest growing specialty, I would say.
and something that's of a great interest in the general public also, because everybody wants to look good, everybody wants to appear better, everybody wants to take care of his own skin, and that's why the cosmetic industry also is growing by leaps and bounds.
Definitely.
And what do you have to say about cosmetics?
See, generally, it's a very tricky question, Deepak. As you said, people, they want to look good. They're right. We cannot deny that aspect. At the same time, as a doctor, some responsibility on our part, to educate the patient regarding the harmful effect of cosmetics. There are a lot of cosmetics which are not good for the skin.
Okay, for instance,
allergies. A lot of ingredients they mix.
Okay.
It's in India.
You know about that bindi, that's normally available, which can cause
bindi dermatitis. You can cause severe allergic dermatitis.
Okay.
And
discoloration of the
yes,
skin
and
also.
if you persist with that, it can lead to chemical leukoderma.
Okay.
See, imagine the amount of this thing, the tension they'll have afterwards.
Okay. Is it actually true that some people say that there is presence of human placenta and things like that in some of the cosmetic
That is
products?
scientifically, they extract some of the ingredients from placenta. Of course, after taking all the precautions, HIV test, hepatitis B test, they do that.
But
and
why?
See, there are certain ingredients, they help.
Particularly in lipstick, is it true?
Not really.
Let us not be so specific.
Not really. And I like that lipsticks, so many cosmetic contain lead, high lead concentration. Some famous
brands
paper it came, doctor, there's a lead in my lipstick.
Okay.
A lot of,
But people cannot live without using these cosmetics, right?
See, that's what the choice. See, as a doctor, I can educate the patient. I can tell
because
this
even the toiletries too, these days are semi-cosmetic in nature.
Exactly.
Because even like when you're using a shampoo, the purpose is not just to wash your hair, but
fragrance,
also because
feel
the
good factor.
fragrance
A lot of factors influence
the shine and the luster.
Even the
and all
package,
that.
how it comes in the package, everything.
So what about shampoos, doctor?
See, shampoos, they do help us.
Okay.
The various commercially available shampoos, all those things. So it depends on the patient's, hair condition, if it's dry, oily, all this.
What is this new thing about TFM that people are talking about?
See, basically it's a people's choice. If you ask me to classify shampoos, it's very difficult. What is good for you may not be good for others.
Okay.
Basically, one has to use it and settle down to a shampoo which is comfortable to them. There's nothing called the shampoo for a patient. If you ask me which shampoo is good for me, there's nothing like that. You have to use it. If you're satisfaction, you can
Because
continue.
sometimes the shampoo companies themselves talk about, this is for dry hair, this is for oily hair.
There's a marketing gimmick, all the things. They add lots
There's
of
nothing like that.
They add lot of vitamins to that, this thing. See, vitamin has to be taken properly inside. It has to enter the blood and nourish the skin within.
Okay.
Now you apply vitamin B5, B6, all these things.
Okay.
It's just a marketing.
And first of all, the thing stays on your head just for a very short time, even before the
you
body
would have heard a lot of
recognizes
things
what-
about vitamins and all. Now you're thinking, vitamins they've added in the shampoo, vitamins in the this thing. It's all market. If you analyze skin scientifically, all these things, what you take internally, that matters.
But is it actually true that the skin tends to absorb a lot of things?
Definitely.
Because when you wear makeup for a very long time, there is this possibility
There is
that the body is constantly...
definitely, no doubt in that. There's a lot of absorption from the skin, especially body folds, sensitive skin.
That could lead to some kind of problems with the kidney also, because ultimately it will reach the kidney, because in the heavy metals
kidney,
that is
why
there.
kidney? It can heart, liver,
Yeah.
kidney, any organs, because absorption, finally on a long run, it is as good as taking internally.
Okay.
That you apply on a large surface area. And body fold. There are some sensitive areas, underarms, side of the thigh, upper eyelid. The absorption is very faster. The same thing is not true when you apply on the palms and soles. Skin is very thick.
Okay.
Certain things, a very strong ointment which you are supposed to apply on a palms and soles, you apply on these things, body folds and all, absorption is very fast.
Wearing makeup has been there for about 100 years now?
Yeah, you can see Belur, Haladi
No,
temple,
yeah.
everywhere, kajal, mascaras.
But this cosmetic chemical makeup particularly, and that's been for about 100 years now?
Yeah, more than that.
Yeah, first used to be about just a talcum powder, and now it's like almost everything. And I think people have forgotten the talcum powder. It used to be like the snow.
Snow, talcum powder.
Afghan snow was something that was very commonplace.
Common still.
Correct. And but now, so even in so many years that you've not actually seen such harmful effects of makeup, right?
See, there are. See, we deal with the patient.
Maybe we have not seen it so
exactly
manifest,
underreported, not reported. So a lot of people, they do have problems. Sometimes it's not diagnosed, miss the diagnosis. But definitely it's increasing.
If it's chemical, it should be having some effect somewhere.
Definitely.
Okay, what about this pH level that everybody talks about? Is it something that people need to really take it seriously?
Usually, pH, skin is acid mantle theory used to be very popular. It's known to discourage bacteria.
But the skin barrier and all that, that's people are also getting educated about
skin barrier is a very important function. The topmost layer of the skin is made up of a dead layer. It's called stratum corneum.
Okay.
It's a very toughest protein this is, and its main function is to protect the skin. It just will not allow all the organisms enter the skin.
Almost like the cuticle.
Yes, very strong structure. Now this barrier function, when is compromised, all the disease, absorption increases, all the toxic chemical enters. So that's the reason we don't allow the patient to scrub their skin, rub their skin, and compromise the barrier function. Yeah, by compromising the barrier function, it is the protection after all. And see, when you need protection, you need the help of skin. And who is going to protect the skin?
What is the best thing that somebody needs to do? You're talking about relaxation, and you're talking about...
see, any disease, my favorite line is medication and meditation. Medication is 50%, any disease today, not only dermatology, any disease you take, any specialty. Only medication will not help, Deepak. Medication and meditation. This is dawa and dua. See, definitely. See, we as a doctor, most of the time we treat body, not the mind. And mind, most of the time you should not take drugs. You resort to these yoga, meditation, pranayama.
But is it very true that particularly with the skin, your mind plays such an important role?
Definitely. It's called psychosomatic. See, any disease, it has a somatic part and a psychic part. Somatic means body.
About people losing hair under heavy stress.
Imagine a white we look at a patient, he travels in a bus, and suddenly the other co-passenger suddenly turns like this, and you feel so embarrassed, and you feel so humiliated. It's quite a very bad feeling. So, in our case, white patch. This is not a harmful condition. It is just he has lost pigmentation.
Is it also true that sometimes people go through unbearable stress and rashes develop on the body?
Yes, stress. It's called urticaria sometimes. Hives you get psychogenic. A lot of hives you develop. Yes, definitely. This has been proved in recent research. The stress releases.
Is it actually true that these days that you don't see venereal diseases so much? Because people have been a little careful about it.
That's partly because a lot of drugs which they take for other diseases they also act on this. This is called happenstance treatment. They would have taken treatment for some other disease. And this incubating disease got cured.
But for a very long time, dermatology was directly related to
sexually transmitted. It's called venereal disease. Now they change this to sexually transmitted infection.
But now at least you have specializations for that too, right?
Yeah, there are certain.
Or you're still treating the same?
There are certain states they have a separate degree.
Well, that's sort of the most embarrassing thing. If at all you go to a skin doctor and you show some complaint, most often the doctor may ask you about, have you had something,
Generally,
that's one of the reasons many people are actually scared, because what you may be suspected of having gotten into.
That's why the parties and all, generally they don't like to speak to a dermatologist in a corner and all. People must suspect what is he discussing. So it is always,
Okay, but the drugs are really good these days.
Very excellent drugs.
And there is very little surgery. And you're talking about the dermatosurgery.
The dermatosurgery is an upcoming field now, fast catching up, and a lot of centers, they are starting a separate course.
Basically skin grafting, is it?
Yeah, skin grafting is part of it, but still there are a lot of other things. Now you have pimples, acne scars. So there are a lot of surgeries for acne scars. Hair transplantation also is done by dermatologists.
So finally, are you trying to say that this fairness of the skin is something that's just nothing more than an imagination?
Exactly.
But some people say, right, after applying a certain cream for a longer time, the skin was actually turning a little fairer and all that.
It's just like this, Deepak. You're getting back your own color by paying money. You're getting back your own color.
Okay.
Due to various reasons, you got tanned.
Okay.
That's it. And by applying the medicine, you're removing the tan. So
Oh.
finally, you're getting back your own original color,
Okay.
and you have spent a lot of money to get back your original color.
But whatever is your original color will
That's
stay, is it?
That is ultimate. No, that is ultimate. There is no medicine to make fairer than that.
But there is something like bleaching also that people have
Temporary,
gone
yes, it's
to.
bleaching temporary. How long it's going to last? For a few days, you have some important function, bleach, go, look good, then come back. That's it.
Okay.
Bleaching and all, there's no permanent this thing.
Okay. But when people use a certain medicine for skin diseases or
Yeah.
some skin problem or whatever, is it always necessary that they need to consult a dermatologist, or sometimes, and like you say, you know, because you know some things can actually be cured without actually going all the way to a doctor.
Yeah, there are certain things, but I would definitely, advise patients, not to try this over-the-counter medicine without consulting a doctor.
Okay.
A lot of things can happen. It's better not to
Because
get
problems
later.
like dandruff, there are a million things
See,
available, not
see
just medical things, but also cosmetic products.
See, for a patient, anything which scales on the scalp is dandruff, but it's not so simple.
Okay, it
There
could be
is
fungal.
infection, yes, definitely, or it could be there's condition psoriasis.
Okay,
There are
okay.
other conditions. There's a lot of conditions which
So
scale on
just
the
scaling doesn't mean that you
scaling
have-
does not mean he has dandruff.
Okay,
Since it is very common disease, people whenever they see scaling on the scalp, they say I have dandruff.
okay. And
It's not-
also the kind of ticks and mites and other pests that are on the body, many people live with them
Live
without
with
even knowing
Exactly,
that they are being
exactly. That's ignorance.
infested.
That's ignorance.
Correct?
Correct.
So is it like, I mean, doing a self-checkup is also quite important.
Definitely.
What can a
100%.
person do?
See, basic hygiene when you're taking bath, inspect your body folds, especially between the toes, groin, underarms, especially the space between the fourth and fifth toes. One of the commonest place for fungal growth. You won't even know this fungus is growing there. It's so silent. That
Okay.
could be the first indication of diabetes. The first
Okay.
indication, if a patient comes to have this problem, doctor, if they, you always suspect diabetes. You tell,
Okay.
get on blood sugar done. That is an indication. Many times you detect a diabetes by merely looking at fungal infection between the toes.
Okay. And also particularly as you're aging, there are a lot of things that happen to your skin,
Definitely.
like
Definitely.
discoloration, pigmentation,
Pigmentation, wrinkling.
wrinkling
Yes.
and all that.
Yes.
And people also need to be mentally prepared to accept all those things, and most often they get scared.
Exactly.
So that's one thing also that people have not been paying much attention to.
That's the reason this cosmetic industry is thriving. They all promise.
And people try to people tend to stay indoors and correct?
So the
And not
age-
even go to a
age- the
doctor for
so-called
fear that maybe they are suffering
age-defying-
from leukodema and all that, right?
Exactly. It is they're over enthusiastic, over protective.
Okay.
You
What is a healthy diet actually?
Very simple. I'll see lots of greens and yellows in our diet.
Okay.
Less of fried items.
Okay. Why?
Because see, they basically, as the age advances, the system also, they go slow. You cannot digest everything properly. And what you need is lot of fluid for circulation, for digestion.
Okay.
Water.
Drinking a lot of water?
Yes, yes. I would prefer about 3 liters per day,
Okay.
normal man.
Okay, to ensure that the
Yes, that
quality
is
of your
minimum.
skin
And
is-
anything extra, excess coffee, colas,
Okay.
they dehydrate your skin. Alcohol.
There is this belief also that the more you eat fatty food or oily food, that you tend to get more pimples and all that. Is it actually true?
Not directly related.
Okay.
Food has no direct role.
Okay.
Definitely, some people they do see aggravation of pimples, nuts and all. No?
Okay.
If the patient says, doctor, after eating nuts, my pimples flare up, definitely it makes sense to avoid
Okay,
them.
what about applying oil to your head or scalp or your hair?
See, oil is just like a moisturizer. How you
Okay.
apply moisturizer to skin to make the skin soft, you are applying oil to hair to make it soft. That's all.
Okay, that is all
That's
it
it.
is.
That's it. Not more than
It doesn't help your hair
that.
growth or
It
whatever.
makes the hair soft, supple. If your hair is very dry,
So
it
that
helps.
only means there's so much myth about dermatology, isn't it?
Definitely, definitely.
And the myth survives, and it's big business too.
Big business. These industries, they make use of these things.
Okay.
There's nothing like hair growing oil, magic remedy. There's nothing. Imagine if that were to be the case in India, you would have had all
Okay.
nice hair. You wouldn't have seen a bald person in India.
With that, doctor, it was certainly very interesting speaking with you. Thank you very much for having come to this show.
Thank you for having me.